I'm sure many of you have wondered, what can regularly consuming turmeric actually do for our health? Don't worry, I can guarantee you won't turn yellow. But now let's get serious. I know many people are skeptical when it comes to claims about the health benefits of plants. However, after watching this video, I'm confident you'll see turmeric from a completely new perspective. Why? Because its properties are truly remarkable. If you're dealing with chronic inflammation, obesity, diabetes, skin issues like psoriasis or vitiligo, or even liver problems, sit back and relax. This video is for you. Today, we'll not only discuss the health benefits of turmeric, but I'll also answer many of the common questions people have about it. And at the end, I'll share a recipe for golden milk, a traditional healing drink from Ayurvedic medicine, of course featuring turmeric. In the Q&A section, I'll address the most frequently asked questions about turmeric. You'll learn how much turmeric you should consume, whether it can cause side effects, and what the contraindications are. I'll also explain how to enhance its absorption, whether it interacts with medications, and how to store it properly. Plus, we'll dive into some fun topics like whether turmeric can actually whiten your teeth or help with acne. Sounds interesting? Let's dive in. Let's start with how this extraordinary plant affects the nervous system. Scientific studies show that compounds found in turmeric, especially curcumin, have the ability to protect nerve cells. This is incredibly important, especially today, as neurological diseases are becoming increasingly common. Regular consumption of turmeric may reduce the risk of conditions like Alzheimer's, Parkinson's, or even depression, a growing issue affecting more and more people. What's more, there's evidence suggesting that curcumin may support the treatment of multiple sclerosis and amyotrophic lateral sclerosis. Let's take a closer look at Alzheimer's disease. Here's an interesting fact. Older adults in India are over 4 times less likely to develop Alzheimer's compared to people of the same age group in the United States. You might have already guessed that this is linked to the frequent consumption of curry, one of whose main ingredients is turmeric. Continuing on this topic, let's mention another study, this one conducted on Asians aged 60 to 93. It found that people who consumed curry occasionally, often, or very often scored significantly higher on the mini mental state examination, a test used to assess cognitive function, compared to those who rarely or never ate curry. And what about depression? It turns out turmeric can be a powerful tool in combating this condition, as shown by a meta-analysis, the highest standard of scientific research. So, how long and in what amounts should turmeric be used for this purpose? Studies have shown that after just 8 weeks of incorporating turmeric into their diet, individuals with severe depressive symptoms experienced an improvement in mood. Specifically, the dose was 500 milligrams taken twice daily, with the best results observed in people suffering from atypical depression. But that's not all. The positive effects on the nervous system are just one of the many benefits of consuming turmeric. In a time when nearly everyone knows someone who has battled cancer, it's worth highlighting turmeric's anti-cancer properties. Observational studies show that curcumin, either on its own or in combination with other substances, can help prevent and support the treatment of cancers such as colorectal cancer, pancreatic cancer, breast cancer, prostate cancer, multiple myeloma, lung cancer, oral cancer, and squamous cell carcinoma of the head and neck. Turmeric can also weaken the impact of the world's #1 killer, the leading cause of death from chronic diseases. Of course, I'm talking about cardiovascular diseases. Research clearly confirms that turmeric can protect against various cardiovascular conditions, including heart enlargement, heart failure, atherosclerosis, aortic aneurysm, heart attack, stroke, and cardiovascular complications related to diabetes. Moving on, we can't overlook turmeric's beneficial effects on the digestive system. It turns out that turmeric is an excellent ally in treating inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis. In one study, researchers evaluated the effectiveness of curcumin in patients suffering from these conditions. And what were the results? Using curcumin in the following doses: 550 milligrams twice daily for the first month, then 3 times daily for the second month. In the case of ulcerative colitis, 360 milligrams 3 times daily for the first month, then 4 times daily for the next 2 months. In the case of Crohn's disease, led to significant improvements. Symptoms of the diseases and markers of inflammation were noticeably reduced. Turmeric is also effective in alleviating symptoms of irritable bowel syndrome, IBS. Studies show that it can reduce the severity of symptoms by as much as 60%. What's more, turmeric helps combat Helicobacter pylori, the bacteria responsible for causing peptic ulcers, gastritis, and even stomach cancer. Studies confirm that regular consumption of turmeric reduces the occurrence of peptic ulcers. Scientific research has also highlighted the significant role of curcumin in preventing and treating diabetes and its complications, such as diabetic nephropathy, microangiopathy, or damage to small blood vessels, and retinopathy, which involves pathological changes in the retina. Additionally, turmeric helps lower blood glucose levels and glycated hemoglobin, both of which are crucial for managing diabetes. Now let's talk about another incredibly important function of turmeric: its anti-inflammatory properties. Chronic inflammation is a problem many people face, often resorting to anti-inflammatory medications. Unfortunately, these medications are not without side effects. And this is where turmeric can come to the rescue. Numerous studies confirm that curcumin effectively reduces even severe inflammation, including inflammation associated with joint diseases. For example, one of the earliest studies demonstrating the anti-inflammatory properties of curcumin was conducted back in 1980. It involved 18 young patients with rheumatoid arthritis who were divided into two groups. The first group received curcumin at a dose of 1.2 grams per day, while the second group was given a non-steroidal anti-inflammatory drug, phenylbutazone. Both treatments lasted 2 weeks. The results were surprising. Curcumin showed similar anti-rheumatic effects to the drug, with patients experiencing reduced swelling and morning joint stiffness. Most importantly, no side effects were observed in the group taking curcumin, making it a safe alternative to traditional anti-inflammatory medications. When discussing turmeric, and especially its active compound curcumin, we can't overlook its protective effects on the liver. Scientific studies show that curcumin can support the treatment of various liver conditions, such as liver cirrhosis, alcoholic and non-alcoholic fatty liver disease, and drug-induced liver damage. What's more, research suggests that curcumin may protect the liver from the toxic effects of arsenic, which is particularly important for individuals exposed to this element. Turmeric may also help alleviate symptoms of kidney inflammation caused by systemic lupus erythematosus, an autoimmune disease that affects multiple organs. Kidney inflammation is one of the most common clinical manifestations of this condition. In one study, 24 patients with recurrent or treatment-resistant lupus nephritis were given one tablet containing 500 milligrams of curcumin with each meal. After 3 months of therapy, significant improvements were observed, including reductions in hematuria and proteinuria, which indicate the effectiveness of curcumin in managing symptoms of this disease. Another fascinating study involved 43 patients who had received kidney transplants from deceased donors. The results showed that a treatment combining 480 milligrams of curcumin and 20 milligrams of quercetin daily could improve early function of the transplanted organ and reduce the risk of acute transplant rejection. Turmeric may also bring relief to people suffering from psoriasis, a chronic skin condition for which conventional medicine offers only limited treatment options. Research indicates that curcumin supplementation can help reduce psoriatic lesions. This is particularly important because biological drugs used to treat psoriasis are often extremely expensive and inaccessible to many patients. Turmeric, therefore, offers a natural and more affordable alternative. Staying on the topic of skin conditions, it's worth mentioning vitiligo, a disorder in which the cells responsible for producing pigment in the skin are destroyed, leading to the appearance of white patches. Studies suggest that turmeric's antioxidant properties may support the treatment of vitiligo. In one study, a combination therapy was used, narrowband UVB phototherapy, along with the topical application of curcuminoids. The results showed that this combined approach was more effective than phototherapy alone. For those interested in this type of treatment, high-quality ointments and creams containing turmeric extracts can be found in pharmacies, herbal stores, or online shops. Now let's move on to the Q&A section. Question 1. What is the recommended amount of turmeric and curcumin to consume? When it comes to turmeric, a safe daily dose is considered to be around 5 grams. Interestingly, some clinical studies have shown that turmeric is safe even at a daily dose of 12 grams, taken over a period of 3 months. Question 2. Can consuming turmeric cause side effects? While turmeric is generally recognized as a safe and well-tolerated spice, its consumption can sometimes lead to side effects. A few cases of allergic contact dermatitis and hives caused by curcumin have been reported. Additionally, high doses of turmeric may cause gastrointestinal issues such as nausea, diarrhea, and abdominal pain. Some individuals have also experienced headaches and yellow discoloration of stool. Question 3. What are the contraindications for using turmeric? The main contraindication for turmeric use is an allergy to any of its components or to plants from the ginger family. Since turmeric can stimulate gallbladder contractions and bile secretion, it is not recommended for individuals with gallstones or bile duct obstruction. Large amounts of turmeric are also not advised for people prone to kidney stones, as it can significantly increase oxalate levels in the urine. Question 4. Is turmeric well absorbed by the body? Curcumin, the active compound in turmeric, has low bioavailability in humans, even when taken in high doses. This is because curcumin is poorly soluble in water, which limits its absorption in the digestive tract and its distribution to tissues. Additionally, curcumin is rapidly metabolized and eliminated from the body. Question 5. How can the bioavailability of curcumin be increased? One of the most effective ways to enhance curcumin absorption is to combine it with piperine, a compound naturally found in black pepper. According to scientific studies, piperine can increase curcumin's bioavailability by up to 2,000%. Another compound that positively affects curcumin's bioavailability is lecithin, which is found in foods like egg yolks, sunflower seeds, beans, fish, nuts, and avocados. Furthermore, research suggests that curcumin's absorption can be improved by subjecting it to heat. Some researchers also recommend consuming turmeric alongside fats to further enhance its bioavailability. Question 6. Does turmeric interact with medications, and what should it not be combined with? Yes, turmeric can interact with various medications, either enhancing or reducing their effects. The list of drugs that should not be combined with turmeric includes anticoagulants, antihypertensive medications, and antacids such as cimetidine, ranitidine, and omeprazole. Additionally, caution should be exercised when taking antibiotics. Some studies have shown that curcumin can either enhance or inhibit the effects of certain chemotherapy drugs. Question 7. How should turmeric be stored? To maintain its freshness and properties, turmeric must be stored properly. Ground turmeric should be kept in a dry, dark place in an airtight container, such as a jar with a seal. Under these conditions, it can remain usable for several months. Fresh turmeric root should be cleaned, wrapped in a paper towel, and stored in the refrigerator, where it will stay fresh for about 3 weeks. Dried turmeric root, on the other hand, should be stored in an airtight container in a dark place away from sunlight. Question 8. Does turmeric whiten teeth? While you may come across claims online that turmeric can whiten teeth, many specialists advise against this method. Prolonged use of turmeric on teeth may actually lead to discoloration. However, turmeric does have positive effects on oral health. It can help relieve toothaches, reduce gum and periodontal inflammation, and prevent plaque buildup. Question 9. Does turmeric help treat acne? An increasing number of studies suggest that turmeric, or more specifically curcumin, can support the treatment of certain dermatological conditions, including acne. Both oral and topical applications of turmeric have shown promising results in conditions such as atopic dermatitis, oral lichen planus, and radiation-induced dermatitis. Turmeric can also be used to reduce skin discoloration by preparing a homemade face mask. Here's a simple recipe. Combine 2 tablespoons of honey, 2 tablespoons of olive oil, the juice of half a lemon, 2 tablespoons of turmeric, and 1 tablespoon of cinnamon. Mix all the ingredients thoroughly, then apply the mask to your face for about 10 to 15 minutes. Afterward, rinse it off with lukewarm water. For the best results, use this mask twice a week. Question 10. How can you incorporate turmeric into your diet? Turmeric is a versatile spice that can be added to a variety of dishes, such as soups, meat, fish, and vegetable dishes, as well as rice, grains, and whole grain products. It's important to add turmeric toward the end of cooking to avoid a bitter taste. Turmeric also works wonderfully in beverages such as teas, smoothies, and lemonades. One drink I highly recommend is golden milk, a traditional Ayurvedic beverage that boosts immunity and helps with colds. To prepare it, you'll need 1 teaspoon of ground turmeric, 1/4 teaspoon of ground ginger, 1 teaspoon of cinnamon, 1 tablespoon of honey, 1 teaspoon of coconut oil, and 1 cup of milk, either dairy or plant-based. Place all the ingredients in a small saucepan and heat over low to medium heat, stirring to combine. Add the honey at the end, once the drink has cooled slightly. Turmeric is an extraordinary spice with a wide range of benefits, from supporting the nervous system and reducing inflammation to improving skin health and aiding digestion. Regular consumption can offer numerous health benefits, but it's important to keep in mind the contraindications and potential interactions with medications. I hope today's episode has been inspiring and provided you with valuable information. If you have any questions or would like to share your own experiences with turmeric, feel free to leave a comment below. See you in the next episode. Stay healthy and take care.